I gather you've had a really good day. I apologise I haven't been able to be with you. I've had other meetings that I've had to be at. But my name is Phil Moore. I am a GP and I'm chair of the Mental Health Commissioners Network for NHS Clinical Commissioners. Oh, thank you. We have got 3 speakers. I'm going to start off briefly, and then we've got 2 others coming to speak, which I will introduce in a moment or 2. What we want to have a look at is how we work together to improve mental health services. There's a lot in that title, and I don't think we should take it for granted. But just first of all, a little bit of background about me and what I'm doing with NHS Clinical Commissioners, which is a membership organisation that has been there to encourage and support clinical commissioners to have a strong influencing voice and to improve the health outcomes for people in their areas. And the networks, of which the mental health one is one, is about giving an opportunity to share expertise, information, support, tools and resources that will help us be more effective in our job. And it's been around for a few years now, and it's aimed at clinical commissioning leads and also senior CCG managers who work in mental health commissioning. And it's there so that we have, as we said, a strong collective voice, we share practice, and we develop the opportunities and peer support to enable us to improve things all round. Now, I'm not going to go through these, but if you are interested later and you want to have a look at the slides, this gives you a flavour of some of the work that we do around working with other organisations, collaborating, and some of the educational and other things that we do. But I'm not going to labour on that. You can look at that later if you are interested. So how is commissioning changing? I've heard people express, well, commissioning is going to completely disappear with integrated care systems, isn't it? I don't agree. I think whatever happens, we will need the skills of clinical commissioners within integrated care systems to ensure that we design and deliver the very best services that we can for people. And it's not just about them, which I'll say more about in a moment. But just to emphasize that there are 3 levels that will be coming about within the integrated care system, which will cover the whole country by 2021. And we will typically have a single clinical commissioning group for each integrated care system, with CCGs being leaner and more strategic. And they will be there at a system level to work with partners such as local authorities, providers, community organisations, to have a focus on population health, service redesign, and of course the implementation of the long-term plan. That's a very strategic, broad area that we'll be all cooperating on. And then there will be place, which often will be kind of a borough level, depends where you are in the country as to what that means, which will look at how we blend health and social care increasingly to use the budgets effectively, and we will have the option to merge those budgets where everybody agrees that that makes sense. And finally, we come to neighbourhoods around 30 to 50,000 people, where primary care networks, another acronym for you, will work together with all of those other partners to deliver population health and much more than that. Now, that's quite a significant change in the way that things will be configured. So clinical commissioners are going to be changing, and there's recently been a booklet published looking at how that will look in the future. And some of the phrases that are used in there are a unique system-wide place and community perspective. Very important. People who are close to the ground, who know the people they're working with, who've built relationships, usually over very many years, form a good foundation for taking things forward. We'll work in partnerships with everybody and his uncle, organisations, patients and public, with feedback from peers. And we'll spend money wisely and drive through changes. Now, those are high-level things that are important, but how easy are they to achieve? Well, you've got to achieve it at 3 levels of a system, somewhere around 1 to 3 million, a place, 1/4 to 1/2 million, and a neighbourhood, 30 to 50,000. Lots of things that are going on there. I don't want to dwell on that. What I want to use is an example of what we do in just a moment. However, it's not just clinical commissioners that are going to deliver this. Increasingly, we need to work in partnership with other people. A couple of years ago, Rethink published Progress Through Partnership. I don't know if any of you saw it. I wrote in there, why would we even think of designing and implementing a service without the input of the people who need it? It's easy to say, not so easy to deliver, but it's important. And that's been followed up this year with the publication of Working Well Together, and that defines co-production as an ongoing partnership. This isn't just bringing people together and saying, what do you think? Okay, bye-bye, leave it to us now. It's an ongoing partnership between people who design, deliver, and commission services, working with the people who use them and people who need them. And that includes users and carers and the public. That's very important, and if you look in that booklet, you'll see that there's an acronym of caring, looking at celebrating involvement, being adaptable, using resources, the influence of power, being needs-led, and having growth at its heart. You can look at the details in that document. So we need to work very closely with the people who know about the services, not just as clinicians and professionals, but as the people who use them, need them, and at times, I'm sad to say, have suffered them. We need their input to get it right in the future. So let's look at one area. I want to just look at crisis care in mental health for a moment, and what are the commissioning challenges? First thing is, we're not starting from an easy place. Less than half of our community crisis services are 24/7. Only 14% of people report a positive experience of crisis care. Even NHS UK website refers you to the Samaritans or Mind if you're experiencing a mental health crisis. That's not ideal, much as they do a fantastic work in those voluntary sector organisations. 58% of crisis services aren't commissioned to accept referrals from anyone. And finally, we need to focus on suicide prevention and postvention if we're to make a success of crisis care. So that's a starting place. So we're not starting from a brilliant place in the first place. And then comes the 10-year long, I shall say that again, the 10-year long-term plan. And that's set out a lot of targets that we are going to have to meet. We have to get 100% coverage of 24/7 age-appropriate crisis care via NHS 111, 24/7 crisis resolution home treatment teams, a range of alternatives to emergency departments and A&E, ambulances upping their game and having the training and the support to achieve that, with mental health professionals in all integrated urgent care services, all non-mental health hospitals to have liaison services, to start with therapy as soon as you get admitted, if you have to be admitted, so that there's no delay. I've heard so many people say that relatives have gone in and it's been weeks before things have started because all kinds of things are being sorted out, and suicide prevention is a vital thing. That's a lot to deliver in 5 years when you're starting from this starting place. Is there some good news? Yes, there's some great news. Currently, we spend about 10% of the NHS money on mental health, and of the 20.5 billion uplift, 2.3 billion is going to mental health. That's brilliant news. And if you look at the money that's going into each of those areas, that's what it looks like. And the summary of that is we've got 1.3 billion to spend on crisis mental health care over the next 5 years. And that frightens me. Because there is a risk when we've got to deliver all of this stuff in a short period of time with a lot of money, we won't have the capacity and the expertise and the ability to make sure that money is put to best use. And the worst thing we can do is simply roll that money after all the money that's gone before it, because when we do more of the same, we're going to get more of the same. And we need to be creative and deliberate about the things we do to make it happen in the future. So our commissioning challenges are around that significant investment. We've got to see how that's going to go, and the investment in mental health is going to grow faster than the overall NHS budget. We've got to invest in CYP services, children and young people services, even faster than the NHS growth. And I think that's a real challenge. How are we going to use that money? Not simply to bolster things, but to transform them. Coping at the same time with huge organisational upheaval in the NHS, one of the biggest changes that's happened for a number of years. We've got to do it at pace and scope, and we've got to have our 5-year plans ready by mid-November. That's quite a short time to begin to spend the kind of money that we're here talking about. And a big one for me, workforce. And if you want to look at some of the indicative numbers on workforce, we have to ask ourselves, where are those people? Some of you are here, but not these numbers. If I was talking to that many people, I'd be delighted. We've got to find a lot of people with the expertise, and I think we've got to do a number of things. Number one, we've got to do the education and training so that every professional is working at the top of their license. And then we've got to bring in behind those professionals trained peer workers who can actually do a lot of the work very effectively, because they're able to say to people, yeah, I know, I've been there, it's tough, but we can work through this together. And that will enable the professionals to deliver what they can. It's not the whole answer, but if we miss that, I think we've missed a very important aspect. So you've been very patient listening to me. We're going to move on to our other speakers now, and later on we will have an opportunity for questions where you can come back and ask anything you want to and challenge anything that you feel you want to as well.